Hello everyone. We have a 42 year old woman who come to you for 4 weeks of episodic upper abdomen pain. It's a burning pain that vexes and veins and is associated with nausea. Several occasional pain has awakened her at night also. The lady has immigrated from Vietnam 1 year ago. Stool guac is positive and was the most likely underlying cause of this patient's symptom. Well, before I proceed, there's something called stool guac is positive. So that we have the options, but before I proceed further, whenever you are getting a word stool guac positive, it means upper GI bleed is there. Golden line to remember. Upper GI means the bleeding is above the ligament of Treats. For all practical purposes, when we say stool guac is positive, bleeding is in the stomach or duodenum. First and second part of duodenum. It's so simple. Now I make this question very simple for you. So we are getting to upper GI bleed, and as I told you, any question you get, look into this. If you look into option biliary cholesterol supersaturation, will it lead to upper GI bleed? No. Gastrin secreting pancreatic tumor. Well, that one possibility is there. Immune mediated bile duct injury? No way. Urease producing bacterial infection? It can lead to. Esophageal sphincter dysfunction is usually not a cause. So that means we are left with B and D. Now let us see what is more likely in this case, and of course I'll be discussing all other options also. Here the answer is urease producing bacterial infection. It is more appropriate as compared to option number B. Why? We'll discuss now. This patient has chronic intermittent epigastric pain, postprandial discomfort, typically of dyspepsia. Common cause of dyspepsia include NSAID, GERD, symptomatic infection like peptic ulcer disease, which is caused by Helicobacter pylori, gastric or esophageal cancer, or functional dyspepsia. Well, when we are talking about urease producing bacteria infection, so now I have a question. Write down the answer. What are the urease producing organisms? Well, the answer is H. pylori, which is there. In addition, Klebsiella and Protease. And these two bacteria are very, very important in hepatic encephalopathy. Why? Because in hepatic encephalopathy they are a source of ammonia. Definite diagnosis of dyspepsia require endoscopy, a procedure that is invasive and relatively expensive, especially given the benign nature of the most of the cases. But there are certain indications where you like to go for endoscopy if the age is above 55. Or we are having alarming symptom like weight loss, bleeding, stool guac is positive, anemia, dysphagia, or persistent vomiting. In those without alarming symptom, evaluation for H. pylori infection test can be performed by urea breath testing or stool antigen test. Patient who fail to improve after initial management, antibiotic if positive for H. pylori or proton pump inhibitor, then only they should go for endoscopy. Now let's look into other option. Biliary cholesterol supersaturation is involved in cholesterol gallstone formation, which can result in biliary colic or acute cholecystitis. And moreover, the pain due to biliary colic is more commonly dull and associated with nausea and diaphoresis. Biliary colic typically does not cause positive GUAC tests. Acute cholecystitis normally present with fever and right quadrant pain. Murphy's sign is positive. This is again a very, very important sign. Okay, so before we go, let us see how these cholesterol gallstones happen. Normal level of cholesterol, bile salt, and phosphatidylcholine, the biliary muscles and vesicle, they remain unsaturated with cholesterol. But when the increased cholesterol occur, decreased bile occur, decreased phosphatidylcholine, then bile becomes supersaturated with cholesterol, and that lead to cholesterol gallstones. So you can see that either cholesterol increases and bile acid reduce, and that lead to formation of cholesterol stones. Now let's look into other option. Gastrin secreting pancreatic tumor, so-called Zollinger-Ellison syndrome, they can lead to dyspepsia. They are usually accompanied by chronic diarrhea and weight loss. The question is, why diarrhea occurs in these cases? Write down the answer. Diarrhea occurs because the reason being, in such cases, large amount of acid is secreted, excess amount, and that neutralizes alkaline pancreatic secretion, and that's lead to steatorrhea, and that can lead to diarrhea. Our patient has nighttime pain. This raises suspicion of malignancy, but pain from symptomatic H. pylori can be exacerbated with fasting at night, so-called circadian acid secretion. Now I have one more question. What is circadian acid secretion? Write down the answer. Peak in acid secretion occur normally between 10 p.m. to 2 a.m. Basal acid secretion is in the waking stage is minimal in the absence of meal stimulation. That means the fasting state it is minimal, but otherwise peak occurs somewhere in 10 p.m. to 2 a.m. Option C, immune-mediated bile duct injury. Again, I've got two questions for you. Write down the answer. This disease occur in this condition. This is occur in which disease, and which antibodies are seen in this disease? Okay, that is immune-mediated bile duct injury. Write down the answer. This occur in primary biliary cholangitis, which was primary biliary cirrhosis was the previous thing, but now we call it primary biliary cholangitis. It's an immune-mediated destruction, most frequently present with chronic fatigue. Pruritus is the most common presenting feature in these patients. Antimitochondrial antibody are there in 95% cases. Immune-mediated villus atrophy. Again, question for you. It is seen in which disease, which antibody are seen, and it is associated with which HLA is a very, very important disease. This you should know in and out. Write down the answer. Celiac disease leads to immune-mediated destruction of the intestinal villi. It can be asymptomatic or may cause severe diarrhea, flatulence, or iron deficiency anemia. Dyspepsia is not a common feature. Which antibody are seen? Anti-tissue transglutaminase antibody. And it is associated with which HLA? DQ2 and DQ8. DQ2 is 95%, DQ8 is 10%. Let's look into other option. Lower esophageal sphincter dysfunction. Okay, in achalasia cardia, there is a failure or relaxation of lower esophageal sphincter. GRD may result from decreased resting tone of the LES. Echolalia are often present with dysphagia, difficulty swallowing, belching, and weight loss. And GERD can present with heartburn symptom, especially in lying supine. It's often commonly accompanied by regurgitation and dysphagia. Golden line to remember: Helicobacter pylori infection predisposes patient to peptic ulcer disease. This commonly present with dyspepsia, postprandial fullness, and nausea. Well, I hope you liked the session. Just to inform you, we have following courses for you. Smart Medicine. There are 350 hours of pre-recorded video lecture of whole internal medicine. It includes all super specialty and allied subject, covering A to Z, including basic concept about every topic. Second, we have tests and discussion. There are more than 1,000 questions with discussion of the questions, sample question and discussion you saw in this session. Now, third thing is Medicine Simplified, which is a textbook of medicine. Harrison is the ultimate book to read medicine, but it is too vast. Reading one page of Harrison, you need half an hour. To understand, you need 2 hours, but you need only 2 minutes to forget what was written in that page. Then what is the solution? We have Medicine Simplified. It's a textbook of medicine, but so-called mini Harrison. It's a summary of what you need to read from Harrison. The book is available in Amazon also. Now, these 3 things are more than enough for your MD, DNB medicine and family medicine final exam preparation, NEET SS exam preparation. You don't need to read any other book. These 3 are complete in all the aspects. For more detail, you can contact at this number. It's a for mobile as well as WhatsApp. And this is my personal email ID. Anybody want to reach to me, you can contact me at this email ID. Thank you very much.